Okay, good evening, everyone. I apologize for the slight delay in the start of our webinar tonight. Had a couple of technical difficulties. In a moment, we'll be joined by Tamme Nash from the Sable Insurance Agency. My name is Mike Hebron. I'm the Chief Operating Officer and one of the owners here at Level Financial. And tonight's Medicare Made Easy webinar is something we do every year right around this time, right around the time when we start thinking about enrollments. So let me start with a couple of ground rules real quick for the webinar. If we want to keep it interactive, so if you have a question that you'd like to ask in the middle of this presentation, please simply use the chat feature below in your menu. You can write your question, and then I will jump in and interrupt Tamme at the opportune moment to pose the question. If you want to have a more one-on-one session with Tamme or talk to her about your specific situation, we do have our automatic text line that we use each time we do one of these webinars. So if you, and I'll put this in the chat feature as well, if you text the word Medicare to 716-727-5047, we will make sure that after tonight's presentation that Tamme will reach out to you and she can discuss your specific situation. So let me introduce Tamme. So Tamme is a licensed insurance benefit coordinator for the Sable Insurance Agency, and she's been working in the Medicare health insurance field for 26 years. She's lived in Amherst here in the Buffalo area her entire life, except when she attended Johnson & Wales University in Rhode Island for 4 years, where she received a degree in hospitality before switching over to the insurance industry. In her spare time, Tamme loves to travel and sit down and actually have dinner with her family. And she loves photography and has 4 beautiful children and 3 dogs, which I think the last time we did this were puppies.
Yes.
So Tamme, let me hand it over to you. We'll start the presentation. And like I said, if anybody has questions, please jump in, and over to you.
Thank you, Mike. Thank you, everybody, for coming out on this beautiful September night. We have had the most beautiful September I've seen in a long time. So we are going to just talk today about the ABCs of Medicare, just general educational Medicare information. And like Mike said, if there's any questions throughout the presentation or at the end, feel free to put things in the chat. And certainly my information at the end of this presentation will also be included. So you can always feel free to call me, text me, or email me. So once again, thank you so much, Level and Mike and all the advisors, for having me this evening. It's always a pleasure working with you and your clients. I look forward to it always. So tonight, like I said, we are going to talk about what is Medicare. So Medicare is health insurance for entitled beneficiaries 65 years or older. Some individuals are put on Medicare a little sooner, under 65, with certain disabilities. And then anybody, any age, with end-stage renal disease or who are diagnosed with ALS. On the administration side, when anybody gets any mail or paperwork from Medicare, they might see the term CMS and any paperwork on emails, whatnot, and that stands for Centers for Medicare and Medicaid Services. So some general enrollment periods for individuals like wondering, when would I start the process of enrolling in Medicare, or why am I getting mail so close to my birthday? And nowadays they send solicitation, the insurance companies, well before your 65th birthday. But these are certain periods at a glance that are on this webinar this evening that are really important to people that are turning 65 or involved in any kind of retirement status when they can enroll in Medicare. So the initial enrollment period, other term for it in parentheses is IEP, that will begin 3 months before your 65th birthday, the month of, and 3 months after. So anybody that is turning 65 By law, they're going to start to get a lot of information, or they're able to enroll if it seems appropriate for them 3 months before. If they enroll 3 months before, they will be eligible for Medicare on the first day of their birth month. If they enroll in their birth month, it'll be eligible the month after their birth month, and then 3 months after. The general enrollment period for people that may unfortunately miss their initial election period, that begins January 1st of every year through March 31st. So if somebody missed their 7-month window and they were individuals that should sign up for Medicare, they were already retired or working in a small business under 20 employees, and they missed that 7-month window, they will be eligible to sign up again, but they can't do it until the beginning of every year through March. So like I said in the presentation, January 1st through March 31st of every year, that's their general enrollment period. So if they enroll in January, it would start in February and then the months on. But unfortunately, in most cases, penalties will usually apply. On a side note, I know postal service workers this year are given a grace, given some grace on applying for Medicare if they didn't sign up when they were eligible way back when or whenever that was. And they were able to sign up through a certain amount of time at the end of this month, even if they didn't sign up 10 years ago, and not worry about a penalty. They were given this little special election period, and they will not have penalties apply if they take advantage of that. We've had a lot of calls on that. Special enrollment periods, that would be pertaining to individuals who are working and covered under large employer group coverage, and they're covering either themselves or a working spouse, and that it's 20 employees or more, okay? So a special enrollment period would be for people that don't necessarily have to sign up for Medicare in their initial election period, and they decide to work a little longer, and their business gives them the insurance, and the business is over 20 employees, they can waive Medicare at that point with no penalty. But 5 years down the line, when they're ready to apply, they can apply, and they have this special enrollment period. That special enrollment period for Medicare Part B will run 8 months from when the retirement date begins, or when they lose employer coverage through their spouse. So there is an 8-month window where you don't have to worry about penalties. But the only thing about that, in the world of Medicare, within that 8-month window, if you don't sign up for a drug plan once your group coverage ends within 63 days of retirement, if you're already on Medicare Part A, you can be penalized. So most people, especially these days, and we try to prepare people and tell them, hey, let's prepare for Medicare so you're not going too many months without insurance. But by law, you are allowed that grace period of 8 months if you do qualify for a special election period. Okay. Enrolling in Medicare. So how must somebody enroll in Medicare? Well, individuals that are turning 65 and are automatically collecting at this time their Social Security income, they will actually get their Medicare card, sometimes unbeknownst to them, just about exactly 3 months from their birthday. So if they are eligible for Medicare in October, their birthday is sometime in October, that card will usually show up in July. For people that aren't already collecting, if they're interested in jumping in and applying online, they can do that, and the website is on this webinar. They can apply online. It's very easy to do that. You do have to set up a portal, which is kind of nice because nowadays, if you already have a portal set up or you have to create one when you go in to apply for Medicare, you'll be able to follow your application. It really kind of keeps you informed on the process of when things are moving along with your application. It is the most simplistic way to do it, but people still, like me, like to talk to somebody, like to see them in person. So if that is something people want to do, you can go into your local Social Security office in your residing county. You would have to call the national Social Security number on the webinar here. that 1-800 number in order to set up that appointment in person, or you can also call the number to set up a phone call appointment to do in the comforts of your home. The only thing about that, especially at this time of the year, we're going into the last quarter, it's a very busy time of year when people apply or retire and they want to start fresh into the new year. So this time of year tends to be a little busy. So if people are trying to pre-plan and they want to do a phone call or in-office appointment, you got to expect to have about a 6 to 8 week wait in order to sit down with somebody or have that call. Now, why would I delay enrolling in Part A? So there's a lot of, I mean, we could sit here for hours. These are sometimes questions that are really individualized in people's situations, but broad spectrum. Some people will say, well, if I'm still working, you know, I'm going to be turning 65, but I don't plan on retiring, I'm just not going to do anything at all. And you don't have to do anything at all. You don't have to apply for A. You don't have to apply for B, as long as you have a reason over 20 employees and still working, or your spouses, and you're getting group insurance. People, though, sometimes like to take the A only because it doesn't come at a cost. But individuals that call in and say, well, Tamme, you know, I'm hearing all these different rules and regulations. What must I do? And if somebody is turning 65 and they're still working, the big question I ask them is, if you are going to want to take A, my only stipulation about that, it can't hurt you because it doesn't cost you anything for A. But if you are participating in a high deductible HSA product or HDHP product through your employer that you contribute, money is put aside, tax-free dollars into that, you know, health savings account to use for medical expenses, you're not supposed to enroll in Part A, since you are not allowed to participate in another health insurance plan and contribute to an HSA. So once again, if you are eligible for Medicare but still plan on working, and you come in and you say, Tamme, I want to stay on my high deductible HSA, I'm going to tell you to stay completely away from Medicare A and B, obviously altogether, because it's like double dipping. You know, remember, and you're going to hear this further on in the presentation tonight, Part A covers 80% in the hospital. So if you're also putting money aside into the HSA, that's all basically considered double dipping, and it's a tax penalty. So they'll fine you for that. A little bit more on the HSAs to be a little bit more clear for individuals. So individuals then, once again, in that case where they at 65 are like, okay, I'm not going to take Parts A or Part B because I'm still happily employed or I'm under my working spouse. But then you're preparing 5 years later to go into, you know, Medicare. So what we tell our individuals is you must cease HSA contributions, once again, once you're enrolled in Medicare Parts A or A and B. If you enroll in Medicare after your initial election period, you must cease these contributions 6 months prior to enrolling in Medicare. And once you enroll in Medicare, you do that application for A after your initial election period. Medicare Part A will go back retroactive 6 months prior to applying for Medicare. Any contributions made after the application for Medicare Part A will not be tax deductible and will be subject to a tax penalty. So what I tell my clients, if you're in an HSA, you're happily employed, and you're not planning on retiring right away, you are the individuals that really need to prepare and plan for retirement when you feel it in the future. When you see in that new year coming out, or whenever it is, you see retirement in that horizon, you once again must think about it, because you have to stop contribution to the HSA 6 months before you enroll in Medicare. So there's a lot more forethought when somebody stays under group insurance in an HSA. They have to really pre-plan for Medicare. They have to stop that contribution 6 months out, because once you go in and apply for A is going to go back retroactive. And remember, you can't have A and B if you contribute to an HSA. If there's a chunk of money, once you stop contributing, you have $10,000 in that HSA, it doesn't disappear. you may continue to spend down that existing HSA funds for qualified medical expenses. So you can't buy a TV, but you can certainly, use it for doctor's office visits and qualified medical expenses. If enrolling in Medicare mid-year, your contribution limit will be reduced by the number of months out of the year you are enrolled in Medicare. Okay. Enrolling in Medicare continued. So once again, why would I delay enrolling in Medicare? Part B. So if you continue to work for your company after age 65 and you still have health insurance through your employer, or if you're covered by your working spouse's employer, you will not have to enroll in Medicare Part B. This is as long as your employer group is larger than 20 employees. Most Medicare eligibles will not want to pay an extra premium to Medicare and to the group insurance plan. So when people are, I have these cases a lot where people are working for kind of like a semi-small business, and they're questioning, is it just over 20? It's what the business files with the insurance carrier. So even if they're filing for, for 50 bodies to get the rate, but only 10 through that business are taking it, we're looking at what the business is filing with the insurance carrier for the rate. We're not looking at how many bodies are on the plan. Now, if you are still working, or if you're covered under your working spouse's employer group benefits, and the employer is less than 20 employees, it is advised to take Medicare Part B when eligible. This is due to group insurance carrier rules. It's not Social Security or Medicare's rules. It's the group insurance carrier's rules. So if you do not take Part B when eligible, your group insurance carrier may not continue to pay your claims unless you take Medicare Part A and B, which in this case would become your primary insurance and your group plan would be secondary. I have these cases all the time. And these are, it's hard because individuals, they love their group insurance, they love their employer, and to pay an extra premium because the business is smaller, it gets a little frustrating and people don't want to do it. The problem is the insurance carrier is constantly auditing the group insurance businesses, and they're looking for smaller businesses, and they're looking for the ages of the employees. And most carriers here locally will send out letters saying, hey, we recognize you're of Medicare eligibility. Be forewarned, you really advise to take Medicare. Otherwise, if you don't within that certain amount of time, usually, like I said, we have that 7-month window, we cannot pay claims. We can retract claims from your doctor if you should have had Medicare first. And it's because they want any help they can get from Medicare to pay claims. So for anybody that's in a smaller, even though you're still working, you can apply for Medicare and show continuous group insurance through the forms that have to be submitted. It's not Social Security and Medicare that's going to question you. It's the insurance carrier. They want smaller businesses on Medicare to help pay for claims. And that number is under 20. Now, if somebody is receiving Medicare due to a disability before the age of 65, the number of employees under your spouse's group coverage, if you're being covered by that spouse, and the rules of waiving Medicare Part B are actually different. There's a higher number, it's actually 100 or more, but I always tell my clients, if they're getting Medicare due to disability, it is recommended before the beneficiaries decide they don't think they need it because they're under a working spouse to always call Medicare before waiving Medicare Part B benefits if the disabled eligible is under a working spouse's large group carrier. Once again, because the numbers of 20 under and 20 over are different for a disabled individual getting on Medicare early. So this is that Medicare card. This is the famous card that we're talking about that people are always so worried about. This is what it looks like. And back when I started doing this many, many years ago, what was interesting about this card, up until 2018, your Medicare card would show your name, just like it is here. It would show your Social Security number, and it would show A and B and the dates and your signature. So it was a HIPAA nightmare. If anybody ever got a hold of these older cards, they could take all your information and do many things with it. So finally in 2018, the government said, hey, you know what? We better really fix this. And so now the card looks like this. You'll be given random letters and numbers. Your signatures have been taken off of the Medicare cards. But this is a good example of what the Medicare card looks like. All right. So a little bit more of a highlight on the parts of Medicare is the next part of this presentation. So Medicare Part A, the basic Medicare, if you just decided, hey, Tamme, I'm going to just do Medicare and that's it. I always tell my clients, because Medicare comes to you for free, as long as you've paid into FICA at least 10 years or 40 quarters. I always say it's like your birthday gift. The Medicare, or Social Security is saying, thank you so much for paying into FICA your whole life. We're going to at least give you 80% inpatient hospital. So Part A will always give general basic 80% in hospital. That's what it does. So Part A covers for inpatient hospital, semi-private room and board, general nursing, and other hospital supplies and services. It also is a part of skilled nursing benefit, where you will be qualified to get full-time inpatient nursing and rehabilitation services. Custodial care is not covered. Home health care. Home health care will go back and forth between A and B, but home health care is you will be receiving if needed. It's medically necessary. Part-time skilled nursing care, home health care aides, physical occupational therapy, and speech and language pathology is also covered under home health care. And then hospice care, of course, which gives the supportive services for Medicare approved hospice needs. Part B. Part B is the one that, remember, also covers basic Medicare, but it's the medical side of Medicare. So it's covering the 80% outside of the institution of the hospital. So once again, if people come in and they say, okay, Tamme, I understand Medicare now. I'm just going to do Medicare alone. You're going to have 80% in the hospital by having A and 80% out of the hospital by having B. Part B is going to cover, remember, the medical expenses of physician services, some diagnostic tests, physical and speech therapies again, ambulance, observation stay in the hospital, etc. It will also give, again, some home health care, outpatient hospital services, so outpatient surgery, diagnostic procedures, emergency room, and partial hospitalizations. It also helps pay for durable medical equipment. But why people may hesitate to take the Part B, especially if they're still working and they're working for a larger group, is because Medicare is not free. And this chart for Part B will show today what Medicare costs. Now with Medicare, what is interesting to a lot of people, for as long as I did this, I'd say probably out of the 10 to 15 people I see in a week, I'd say half of them realize that Medicare comes at a cost. So when they come in to see me and they're just starting to think about retirement and they're so excited thinking everything's going to come to them for free in their golden years, it's a hard conversation to be had, because what happens is Medicare is a sliding income scale that you see here. And they look back 2 years at your modified adjusted gross income, whether you file individually or married, to determine what your Medicare premium is going to be. So this year, when people are coming in and preparing for retirement, or not even retiring, they're going on Medicare, the government is looking back at that income in 22. So even though we're in 2024. So today, this is the chart. People could be paying, $174.70 per month for their Medicare premium, or all the way up to almost $600 for their Medicare premium, depending on what their income is. And that is why sitting down and talking about this before they retire for a financial plan is really, really important. We do not yet know, even though I've already seen most of 2025's products, most of 2025 rules are out. We've been educated and licensed to talk about it. We're not allowed to talk about it till after October 1st. we still don't know yet, and this is the common denominator. Every single year we go through this, we don't still know yet what the final rates will be for B. We've seen estimations, but estimations when we sit down with families and talk, like we are tonight, aren't good enough. We need to really have that final rate. Usually comes lately in the last few years, mid-October, end of October. But there has been years that we didn't find out till November, Thanksgiving time. This year, I'm confident that we'll probably know in the next couple weeks. But right for today, for anybody that is retiring in 2024, this is the rate that that Part B costs. Okay. So Part B, how do we pay for it? So depending on your situation, if somebody is already collecting Social Security or electing to take Social Security upon Medicare, they can have it taken right out of their Social Security check. If you're not receiving Social Security income and you don't plan on right away, you're going to wait. You will be billed every quarter, every 3 months for your Medicare premium. Sometimes in some cases when people come in and we recognize with them and I talking and we're kind of going through the motions of preparing for Medicare, we are able to give some individuals that we notice that might have low income subsidies where they qualify for extra help through New York State due to income. Sometimes when they qualify for a low income subsidy, they will qualify to get the Medicare premium reduced. It's called the Medicare Savings Program, or MSP. So individuals, we do look at that, if people are comfortable talking about their income with us because they're really, worried about how they're going to pay for the Medicare premium, we will help them with those applications. And then over the last 3 years, I'd say, and even into next year for 2025, some of our plans that are called Medicare Advantage plans that you'll hear about in the further part of this presentation tonight, they will also offer reductions due to certain plans if people take those plans in their Medicare premiums. It's called the Medicare Give Back, and some plans do offer that, which is it's a really helpful thing for individuals that need it. Or some people that take insurance in addition to Medicare and they don't go to the doctors a lot and they're paying that Medicare premium, they might look at it as like, oh, that's kind of a win-win for me. Everybody's situation is very, very different. Nobody's the same, even husbands and wives. Okay, so we've talked about the basic fundamentals of Medicare. People will come in, they're ready to retire. They understand, okay, I've got to take the A, I've got to take the B. The B is going to cost me something. But most people know that A and B alone, especially these days and times, unbelievable the cost of medical health care and medications. People know that just Medicare alone, the basic part of Medicare, is usually not enough. Do people still walk around with just Medicare alone? Absolutely. But if you don't qualify for, Medicaid to go with it, that 20% left over can be financially crippling. And when somebody is approaching 65, they're inundated with all this solicitation, all these different companies that are like, listen, choose our plan. We're going to give you this. We're going to give you that. So a lot of times people will come in more than ever. They're very educated in most cases, coming in a little bit on Medicare basics because the solicitation kind of throws it in your face, or we have access now to the TV commercials and the internet and people calling you every day. But what I tell my clients is, listen, like, we want to get to know you, we want to get to know your situation, because even though in this moment that we're sitting in today in 2024, there is actually just short of 100 different choices in Medicare for people to choose from. And it can be very overwhelming and conflicting. And so what we tell our clients is, listen, we're not going to throw 100 plans in front of you. What we want to do is learn a little bit more about you, your doctoring, your prescriptions, because they're not a one size fits all. But this slide is when I sit down with my clients in that first initial meeting, I want to make sure they understand, if you're getting 100 different products in your mailbox, I'm going to have you bring them in, and we're going to put them into 2 categories. Because before you go deciding on the insurance that you think you want, you need to know the differences. There's 2 types of products that you can choose from. There's 100 different plans, but we got to put them into 2 different buckets. And the 2 different buckets that people are going to be choosing between, you need to know what they mean, what they're all about, what they can offer you, what they don't cover. Because if you don't know what these products are, you know, what a Medicare Advantage is versus original Medicare and a supplement, if you don't know what that is initially, it's not going to give you the foundation to choose the best plan or the right plan for you. Okay. So when we come in, I love this slide. I have used this slide most of my career. This slide really has never changed because it really shows the difference in the buckets. So once again, we have a Medicare eligible coming in. We're starting the process of understanding their needs. And we want to make sure the takeaway in our first meeting is understanding what's a Medicare Advantage. So me looking at my screen tonight, that would be the right side of the screen. And if we brought these products in the room, we would separate them into two categories. So Medicare Advantage, what does that mean in a nutshell? In an easy nutshell, even though you went through the trouble to get on Medicare, Part A and Part B, even though you're paying that monthly premium in most cases for Medicare, if you choose a Medicare Advantage plan, which the glorified name for it is Medicare Advantage or Part C, but it's the good old-fashioned HMO or PPO that's available here in our area. If you go that route when you decide to take a plan, that means that even though you're paying for Medicare, Medicare is not primary payer on a Medicare Advantage product. Your plan that you're choosing, that Medicare Advantage product that you're choosing, is first payer, and Medicare is sitting on the back fence. It's very much involved. It's still regulating. It's making sure the insurance companies are doing all the right things. It's being regulated. But when you go to the doctor, blood lab, or hospital, or pharmacy, they are billing the plan that you chose first. Medicare's on the back fence. Now, when you choose a Medicare Advantage plan, you have to make sure, because there's multiple different ones to go with, you have to make sure that your doctor has a contract with that insurance carrier, especially if you do an HMO, which stands for Health Maintenance Organization. That is a very contractual plan that if you want to go to Roswell or Buffalo Medical Group or multiple different offices in the area and you love and trust that doctor, you have to make sure that you're making sure that the new health insurance you choose, you can still see that doctor. There's also plans out there called PPOs or POS plans. PPO specifically, participating physician organization. That is a plan that allows you to go in and out of network, and it's a little bit more of a nationally footed plan. So if you're seeing doctors in network, great, you're going to pay the same copay as you would in Buffalo. But if you're seeing doctors out of area and they're not in network, or even locally, they're not in network with your plan, you can still go there. You're just going to pay a higher cost to do that. HMO, going back to that for a moment, if you're traveling, people worry about that. You are covered out of area for emergency only. But with an HMO, you can't say, hey, I want to see Dr. Jones at Cleveland Clinic, unless you've had, you know, an unsuccessful procedure here. The insurance company is involved. We get permission to go out of area to see a doctor out of contract. Medicare Advantage plans, they're designed in most cases to be a lower premium. They include your prescription coverage, your Part D. So that's also very important. We can have people come in and say, Tamme, this is the best plan. I love it. And we check their doctors, all's good. And then they give me the list of their meds. And some of their meds are not on the formulary with that Medicare Advantage. Then the plan is not going to be suitable. So, in the last 3 years specifically, medications are probably the number one thing I ask first, not to be nosy, but just to make sure we are setting our clients into these new plans up for success, that they're not going to go to the pharmacy and something's not going to be covered. Plans do sometimes with those higher cost biologics, you know, inhalers, different meds, there's so many, they may require a prior authorization, but we've already checked to make sure that the prescription's on the formulary. So prior authorization is just because it might be expensive or there's question about quantity limits. But as much as doctors are so important with these Medicare Advantage plans, making sure they're involved with the plan you're choosing, medications are equally as important. I don't know if I mentioned this already, with the Medicare Advantage being a little bit less expensive in premium in some of our comparisons, it also has more of a copay structure. It doesn't have big deductibles on medical, but you're going to have more of a copay. Medicare Advantage, in most cases, they include some of, I call it the fluff. You get the gym memberships, you get the little bit of dental. You never choose your insurance by the dental they offer because it's not amazing, but it's something. It's pretty decent. You can get eyeglass benefits and a lot of the extra ancillary the benefits that people sometimes look for when they're going and choosing a Medicare Advantage plan. Now, some people will say to me, well, Tamme, that all sounds wonderful, but I would rather pay a little bit more and have little to no copay. Well, there's another product out there that's called a Medicare supplement. So that is when I'm looking at my screen to the left of me, where you see original Medicare. Medigap plans or Medicare supplements, they mean the same thing. They are very, very different than the Advantage. And that is because Medicare is primary. So when somebody does a Medigap or a Medicare supplement, when they go to the doctors or the hospital, they're showing that Medicare card, that red, white, and blue card first payer. Whatever Medicare, it has to be medically necessarily coded. So whatever they're getting services for has to be coded to Medicare's liking. And then if it's approved by Medicare, it will go over to the secondary, the supplement or Medigap to pick up the remainder. Medicare supplements, Medigap plans, they once again have lower out-of-pocket costs. So for example, like there's the Plan G in New York State that people tend to come in my office and ask me about. The Medicare Supplement Plan G is a very comprehensive plan. It's very pricey. There is a first of the year or first of being new to Medicare deductible of $248.50 this year. But once that's spent down, you go to the hospital, you go to the primary specialist, there's little to no copay. So it's a suitable plan for some people. They like the predictability of having, this premium, and that's pretty much, as long as medically, their claims are going through as medically necessary and approved, pretty much everything's being covered. And people sometimes like that. With most Medicare supplements in New York State, we're not going to get the fluff. We're not going to get the dental, the hearing aids, the eyeglass benefits, unless it's after a cataract surgery. Some companies will offer discounts on gym memberships, but they're not in the business for the extra ancillary. They're more about the medical. And lastly, with the Medicare supplements, when people come to me and that's what they're choosing, the drug plan is not embedded in the medical insurance. So when somebody does a Medicare supplement, they really hold three cards. They have their Medicare card, their supplemental card, and then they have a standalone Part D drug plan card. The Part D today here in New York State and in our area, there's 15 different standalone Part D drug plans we can offer our clients. It is my job to, when clients give me their medication list, is to help them fine tune that. I have a special tool that I can use. Individuals individually can go on Medicare.gov and look up different drug plans that are, can go with a Medicare supplement. We tend to do that for our clients because it can be very overwhelming. And then we'll put in their medications and then we'll show them the plans that cover their meds, the deductibles, and things like that. And that is for 2024. A little bit more information, a little extra about Medicare supplement policies or Medigaps. They're through private insurance companies. They're used with original Medicare only. So you must have both A and Part B in order to have a Medicare supplement and even a Medicare Advantage for that matter. Medicare is always primary payer, and it covers the major gaps in Medicare that Medicare, as long as it's Medicare approved charges, doesn't. So that 20% remainder, as long as the initial charges going to Medicare are coded properly, then the remainder will go over to the Medigap policy and they'll pick up the remainder. Sometimes some plans do have small little copays, but nothing very large. With Medicare supplements, it's nice because when people come down to see me, all policies with them are standardized. So we could have multiple carriers that offer them, but they all must offer the same product. It's just different in premiums. So each policy is identical from company to company, but premiums are different and they vary drastically from company to company and year to year. So the last 2 years, the increase in premiums with the companies have been all over the place. So we have a Medicare supplement binder that we literally use every single day when clients come in. And except for in the states of Massachusetts, Minnesota, and Wisconsin, the rules and regulations around Medicare supplements and Medigifts are very different. Okay, hope I'm not losing anybody. Everybody's real quiet. But if anyone has questions or concerns, or I'm talking too fast, just let Mike know. All right, so Medicare Advantage Part C. Once again, going back to our little chart, if you can remember the visual, Part C is another glorified term for HMO and PPO. Medicare Advantage plans, or Part C, are covered services through Medicare Advantage plans. They cover all Medicare services sponsored by private insurance companies. Medicare Advantage plans also may offer extra benefits. Examples in that are, like I said before, gym memberships, eyeglasses, dental, and over-the-counter items. Most of our plans offer what we call OTC, over-the-counter items, that give a little extra quarterly benefit, $25 to $40, depends on the plan, sometimes more, for things like pain reliever, vitamins, Tums, toothpaste, things like that. The drug coverage in Medicare Advantage plans, you can't have prescription drug coverage through a Medicare Advantage. So remember, Medicare Advantage includes, in most cases, there is some plans out there that don't have the Part D embedded. Those plans are specifically designed for people that are like veterans, who have, reasons that they're allowed to waive the D. But if your Medicare Advantage plan has drug coverage in it, you can't just say, well, you know what, Tamme, I really love this company and I know they cover my doctors, but I know my drugs aren't on the list, so I'm going to go with the standalone drug plan. If you did that, what would happen as soon as that standalone drug plan went through, it would cancel out your Medicare Advantage plan. They don't work together. So that is like I said earlier, when people come in and we're looking at Medicare Advantage specifically, it's not a one size fits all. We have to look at your doctors and your meds, because you can't just select a standalone drug plan. It is not allowed. And back in 2006, when this Part D was coming to the table, it used to be, when I started doing this many years ago, people were retiring and there was no drug coverage embedded in these plans. We used to have to call pharmacies, and cost of meds weren't what they are today, of course, but it was unbelievable. And then when Part D came out, there was about a year where people thought, because they weren't educated and informed, in some cases, unfortunately, sometimes they were misled. They think, well, I can do this Medicare Advantage plan, and then I like this drug plan, I'm going to take that with it. And then they were thrown out of their health insurance. Sometimes they didn't find out right away. And that was a real big problem. So if you have a Medicare Advantage, you can't take a standalone drug plan. Otherwise, you will be disenrolled from your Medicare Advantage and put back into original Medicare. Rules for Medicare Advantage. Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans. These companies must follow a set of rules, like we talked about, that Medicare sets. However, each Medicare Advantage plan can charge different copays and out-of-pocket costs. Most companies have different rules for how you get your services. For example, you may need a referral to see a specialist, or you can only go to certain doctors, hospital facilities, or suppliers that contract with your plan for non-emergency or non-urgent care needs. These rules can change from year to year. So, like I said earlier, that is the biggest part. When there's wonderful, in our area, there is actually some wonderful Medicare Advantage plans available. But making sure that your doctors and hospitals are in the network is the biggest key to success with those plans. And every year, and we're about to get into my open enrollment season for annual enrollment with my clients currently in Medicare, that will start in a month. And that's what we've been preparing for, because these plans do change every year. All right. Prescription Part D. I really, with my career, I think this is probably what I do every day is probably where I spend the most time. Clearly, we all know going to the pharmacy for some individuals is tough, very expensive. Medicare has finally, which we're going to touch on very cautiously in a minute, the changes to 2025 are wonderful for our beneficiaries. The world is kind of coming around and realizing that people can't afford medications like they used to. And when people are joining plans, the formularies, like I've said all along here, are key. So what formulary really means, it's a list of drugs that the insurance plan that you're choosing covers. Medicare provides guidelines about the type of medications to be covered, but not the specific drug. So every plan has to offer a certain type of diabetic meds and certain type of blood thinners. Each plan has its own formulary, and Medicare has excluded some types of meds from these plans, but some plans do include them in what we call an enhanced formulary. So with the world of Medicare, one of the biggest things I tell my clients is, as if they're in group insurance and they're preparing to retire, what the biggest difference, I'd say, one of the biggest ones is when people are coming off of group insurance and they've had all these premiums, and group insurance are very expensive. 60% of these group premiums, whether you're paying them or your employer is helping, is medications. And that is, over the years, is just in fluctuated. It's just been huge, increasing in premiums because cost of meds, as we all know, are getting bigger and larger, and they're keeping us alive longer. And so one of the culture shocks when I sit down with families is medications. And when we roll out what the plans that they're choosing are going to cover, and we look at the co-pays and the formularies for these companies, people are wowed by the cost, going into the retired years in some cases, not all drugs, but brand name drugs, how expensive they can be. And the term the donut hole since 2006 has been just always a very big topic of conversation. And so why that is, and this little chart is specific to this year and the past. Moving forward into 2025, there is going to be major changes to this. But today, just to get an understanding, when people come in and they're preparing for retirement and we're running their meds and we're showing them how their meds are going to look in a forecast, there is this 4-stage process that you're seeing in front of you that we prepare people for. And the 4-stage process of Part D, every carrier must follow. It just depends on their formularies and how they shift and the copays they're going to charge, but they all must follow this 4-step process. And this 4-step process has a deductible. So individuals that might have costlier medication, brand names or higher, tiers that are, tier 3s, 4s, or 5s, they might have a first fill deductible. And the deductibles can range between $100 to the max this year in 2024 was $545. Once that's met, they go into what I call the happy phase, the initial phase. And the initial phase is usually that copay phase where people are like, okay, this isn't so bad. And in that copay phase, they might have $1, $5, but every time they fill their med, you'll see at the bottom of the screen this $5,030. There is this bank, I always say it's like an invisible bank of money that the insurance carriers are keeping track of. And every time you fill that med, it's not the copay you're paying. It's the difference between the retail cost of the med and your copay that debits down off of that $5,030. Some people never get to it, but some people do. And they get to it in a month, 2 months, 3 months, 4 months, sometimes, 6 months towards the end of the year. But some people do get to it. And when they get to that $5,030 cap, they go into something called the coverage gap or the donut hole. And that in that phase, individuals have to pay primarily 25% of the retail cost, negotiated rates of the med. And that's also a really important thing when people are preparing to retire, that we forecast for them. So they're prepared and they have the options to kind of decide on what they're going to do. Some individuals fall in the donut hole, and this calculator continues to roll. So even in the donut hole, they're still filling their meds. And in that, if their meds that they're filling, once again, negotiated rates reaches, doesn't go back to $1 in the coverage gap, it's still running from that $5,030 up to $8,000. If you get to $8,000, which is considered catastrophic, then the rest of the year, your meds go to free. I have some people get to catastrophic in the very first month of the year. That is something new to 2024. It used to be when people would get to catastrophic, they would still have to pay a dollar, $5, or 5% of their meds for the rest of the year. This year, when people reach catastrophic, their meds go to free. For next year, there has been something called the Inflation Reduction Act that's been passed through Congress. It is happening. There's been talk about this for probably big talk for the last full year, 2 years. But it's happening. And if you envision what I just showed you the previous slide, what's happening now is they're getting rid of the donut hole phase. So this IRA, this Inflation Reduction Act, has made it so Medicare beneficiaries will now have a Part D maximum out of pocket of $2,000. That is going to be starting in 2025. And that means that the coverage gap donut hole phase will be eliminated. All members in this situation with their plans, and I've seen all the plans and every plan's doing it a little different, but the cap is $2,000. Members will have a simplified 3-phase benefit set with consistency that consists of the deductible phase. So there's still that deductible phase in most plans. Some plans have waived it, just depends on the plan, if applicable. Then there's that initial phase where they're paying that $2,000. And then it goes, once they reach it, it goes to catastrophic. It's a good thing. It's a beautiful thing for people that take a lot of meds. It's taken me, even to this day, we're still learning as we're preparing for October 1 to explain it. Every plan is very different, so every case is going to be very different. But this cap is happening. And with that, we're anticipating rate increases because we know the cost of medications. This is great that they're capping them at $2,000, and some of these medications are thousands. So something in the dam is going to break. And so therefore, there's been a lot of adjustments to health insurance companies in locally and nationally to accommodate for this big change. But for a lot of my clients that I can think of off the top of my head, this is going to be a wonderful thing for them. But we're going to see some changes within the plans because of it. Part D, one thing I want to mention too, I'm just going back to the beginning. Part D too, if individuals have a higher income for that Part B premium, their Part D premiums can be elevated too. It's called IRMA. So when people get dinged on having a higher waged earning on that sliding scale that we saw for Part D earlier, they're also going to get a little bit of an increase on their Part D premium as well, which is all handled through Social Security. Part D, if somebody doesn't sign up for the Part D, like I said earlier, within 63 days of their initial enrollment period, then they will have a 1% penalty indefinitely on their plans for the rest of their life. So for somebody that says, Tamme, I don't take any meds, I'm not going to take a Part D drug plan or a plan with a Part D drug plan embedded, they will be penalized after 63 days of starting the plan. The clock starts and they are penalized 1% for every month they don't have a drug plan. And there is a formula to determine once they do take a drug plan, if they ever do, what that cost will be on the average premium of a drug plan. And this penalty does stay forever. Medicare versus group. Timing is everything. I think you guys can kind of see and hear that throughout the day in the presentation. It's always wonderful to start this journey of Medicare about 4 to 6 months before you anticipate enrolling in Medicare, if you can help that. We tell people to contact us as soon as possible once you feel that you're ready to retire or even thinking about retirement, especially if you have that HSA. What we do is we will review your personal situation, your daily medications, doctors, and any personal needs that you're willing to share. We together will compare the plans offered in Medicare within your state and county, or if you're offered retired group choices. We will research the daily needs as well as expected premiums and copays. Most of my time spent with clients in the last 2 years is individuals that are offered retired group insurance or are still working, and we're comparing to Medicare to see if it's the timing is right, or if that retiree group insurance that's being offered is a financial good choice. I will complete a Medicare review to allow you to plan better for your retirement and be better prepared for this transition financially. Medicare versus group. In some circumstances, when making decisions on choosing Medicare, a spouse that is younger than 65 will play a big part in your Medicare decision, as well as if you have children and kids on your plan. Always looking into your group option of COBRA if offered for a younger spouse, and comparing it to New York State marketplace plans is always a good idea. The Sable Insurance Agency will make sure we help you explore all your choices so you can make the best well-informed decisions for your whole family. We do have individuals in our office that will help you on the marketplace as well. So if there is a younger spouse and they also need assistance, I always do the Medicare side, but we have people in-house that will help that individual for that younger spouse or family that needs help with the marketplace through New York State. We will help with that. So the general enrollment periods, which I am mentally and physically and preparing for, are upon us. And annual enrollment, that term AEP, annual enrollment, for anybody that is already currently in Medicare, will start October 15th through December 7th. It's coming up. Anything that you do in that time period will start January 1st. So it's a 6-week period. It doesn't give us a lot of time. We can start talking about plans. I've already had my book in October is already halfway full. For my current clients, they can't wait to see the changes on their medications and their plans, and they want to talk October 1, which we can, but we can't switch them. We can't do any changing of the plan, take applications until after October 15th, but we can start, telling our clients what to expect with their plans for 2025. Medicare open enrollment period. So this period is for people, we see this often, that in our annual enrollment between October 15th and December 7th, they're busy. It's the holidays. It's a tough time of year. There's snowstorms, there's things. And they might not really realize, or they don't call us, we don't hear from them, and they don't realize that their plan has been changed. And then they call us January 2nd and they say, oh my goodness, I need to change my plan, or I've had a change in my health or a medication. I think I need to change my plan. We can actually do that in that Medicare enrollment period, January 1st through March 31st of every single year. So if you make a change in January, it's going to start in February. We get a lot of those calls in January. People just like, I'm sorry, Tamme, I didn't reach out to you, or I didn't pay attention to my mail, or whatever. We can still help you. The other thing I want to mention as a side note is New York State and Connecticut are the two states in the nation that do not have medical underwriting. So that's a big thing here. Some people, they might take a lower premium plan and then have a medical hiccup and want to switch their plan, or whatever it is, and they want to switch their plan. We can switch our plans in New York State every fall and every winter and not have to ask medical questions. It is very, very wonderful that we have that opportunity. If people are in Florida and they're in their initial election period, and they choose a plan, and then 6 months later, they decide they want to switch that plan, they might be limited on the plans that they can switch to because of medical underwriting if they've had a medical hiccup. So New York State and Connecticut, we do not medically underwrite. So really, during these times of year, we have a lot of ability to make adjustments without asking medical questions. And then some frequently asked questions that I get often is, does Medicare, general Medicare, basic Medicare offer dental coverage? The answer to that is no. Medicare itself will not cover dental care that you need primarily for the health of your teeth. Now, once again, some Advantage plans, Part C, will offer basic dental. Medicare will only offer dental if it's medically necessary, like cancer of the mouth, things like that. But for just the general basic dental cleanings, Medicare does not approve for that. Just the Advantage plans would give you those benefits. Would a husband and wife be in a joint family plan, or are they considered to be on individual plans once eligible for Medicare? A husband and wife must be on separate plans once enrolled in Medicare. There are no family plans for married couples in Medicare with non-group insurance. So Medicare retiree group plans through a business, they will have family plans. But when you go away from a group and you're on Medicare individually, it is individual. You'll have two separate numbers. There's no family plans in Medicare. And then I will leave this last slide up, which is all my contact information, my email, my office address. I'm here locally. I am licensed in multiple different states, not just New York. And you know, I've done this a long time. I love what I do, and thank you so much for your time. I'm gonna turn this over to Mike. I don't know if there's any questions that have come through, Mike.
No questions, but just want to make sure everybody knows one more time that if you want to speak with Tamme directly, you can text the word Medicare, all one word, doesn't matter if it's lowercase or uppercase, 716-727-5047. And we'll make sure that Tamme gets back to you. So I guess, on behalf of Level Financial Advisors and Tamme, thank you for coming. Everybody, just have a great evening. Take care.
Thank you, folks. Thank you so much.
Bye.
Bye.